So, hi friends, we have Dr. Sushant Sarang with us. He is a senior occupational therapist. He is the associate professor at KEM in the Department of Occupational Therapy, and he's also the ex convener of Bombay branch of All India Occupational Therapy Association. He'll be there to answer a few questions for us. Let's welcome him. Hello, Sushant.
Hi, Rina. Nice talking to you after a long time. How are you?
I'm good, very good. And it's nice talking to you also. And thank you so much for giving your time
Hi.
for helping us out with such an important topic. Hmm?
Completely my pleasure.
So, Sushant, I mean, we have so many facilities provided by government, and some parents tell me that fees are very expensive for some of them to afford occupational therapy. So, do we have occupational therapy services provided by government, and some free services or services at a very concessional rates?
So there are government hospitals where the therapies are free of cost. There may be a nominal fee for registration. There may be a nominal fee for any appliances that are needed, like if the person needs or if the child needs any splint or orthosis. But even this cost is way less than what you would get in private. So most of these hospitals and centers by government, whether it is the municipal corporation hospital, or the state hospital, or the central hospital, therapies are free. Now, the problem with these places may be that you may not get enough sessions because the number is so large. You may or may not get enough number of sessions which your child needs. However, you would get therapy at a very nominal cost. So, like I stay in Mumbai, and in Mumbai there are three medical colleges, that is KM Sain and Nair, and there is one at Cooper as well. So these are run by the BMC or the Municipal Corporation of Mumbai. So here occupational therapy services are absolutely free of cost. The parent does not have to pay a penny for it. Similarly, there are institutes, central institutes in Mumbai, like All India Institute of Physical Medicine and Rehabilitation, where again there is absolutely no cost for the therapy. Yeah,
So that way, if a parent is not based in Mumbai and if they're based outside, any hospital which is run by BMC, the municipal
the
corporation or
municipal corporation.
government, would have an OT department,
This
occupational
should
therapy.
this should be having. All big cities have occupational therapy departments.
And even if they don't get those many number of sessions, they at least get the guidance and they at least get some idea, right, on how to work on with their kids.
Definitely. So they may not get thrice a week sessions. They may get twice or they may get once a week. But at least it gives you a head start. At least they will tell you whether you are on the right track or whether you are not on the right track or what needs to be done. So it would definitely be useful. And most of these centers which are in government, they are at par with the private centers as well. Even that I can tell you very proudly.
They are at par, meaning the kind of service that's provided is quite
Yes,
high quality. That's what you
yes,
mean to say, yeah?
yes. The equipments, the service, the professionals who are there, they are very well qualified and the services are good.
Right. So now, what I wanted to ask you is, suppose people who don't stay in cities and they stay in villages and they plan to come to, say, Mumbai or Delhi or wherever that, they find an OT. And if they plan to stay there for a few months, do you think that also is a good idea to get some few number of sessions, understand things, and then go back and practice those and meet up maybe once in 3 months, once in 6 months? What is your idea about it? And this is specifically with respect to kids who have a diagnosis of autism.
So this is an absolutely very good idea. There have been parents who do this. See, because here we are talking about the developmental age, the stage which would be called as a developmental stage of the child. That means every week, every month, there is something happening within the child's body and brain which would help him in development. So even if the parent is not able to take sessions regularly because there are no sessions in that city, it is a very good idea to rent out a flat or to stay with some relative, have sessions. on a very regular basis intensive therapy. So we get many people who come to us in the private centers. They stay here for 6 months or 4 months or 3 months. They take intensive therapy, that is therapy which is 5 days a week, 6 days a week. They go back and then they follow up from back home. So again, this helps. One, we cover a lot of area, and second, when they go back, they are in touch with that therapy center. What is to be done? They have a home program which they would be following it, and then they can just come over whenever it is possible, even for 1 or 2 sessions. If they come for one day, show to the occupational therapist. He can further tell them what is to be done at home, and then that again will take care of the child at least for that period.
So, Shant, a lot of parents tell me that they belong to different cities and every city may not have an occupational therapist. How can one find an occupational therapist in every city? Is there a way to do that?
So generally, what happens is in certain cities like say Mumbai, or if you are in Maharashtra, there is this Maharashtra State Council of Occupational Therapy and Physiotherapy. Likewise, there is one in Delhi and a few of the other places. So one thing what they can do is refer to the directory in these council website. Secondly, a few institutes have their own directories, but this was a few years back. Now the easiest way to find an occupational therapist is just to put occupational therapist around near me on Google, or occupational therapist in whatever place you are in. Now, one important thing which the parents need to know is that whenever they start searching an occupational therapist on the web, on Google, uh, the list which they would get of the top one, two, three, these are generally paid lists, the paid listing. So not necessary that if the person is on the top list would be good. So one thing they'll just get a list of people. You can choose anyone from the list, not necessarily the first or second. And then of course you check out a few reviews and direct reviews of parents who have taken therapy at these places. So the simplest way to find an occupational therapist around you is go on Google, find out. Once you get the person, you can cross check it from the list of professionals in the council.
And how does one get the list, the council, how does one get that council list?
So if I am in Maharashtra, I would just put and it's something like Maharashtra Council for Occupational Therapy. So the name is Maharashtra State Council for Occupational Therapy and Physiotherapy. But if I just put Maharashtra Occupational Therapy Council, then I would get it. Similarly, Delhi Occupational Therapy Council, you would be referred to the website of the council.
So in the website, if they put the name of the therapist, they would know whether that therapist who says that he or she is an OT is actually registered with the council. That's
Registered
what
with
you
it.
mean to say.
Correct. Yes. Yes.
And registration to this council is important before they start practicing as a therapist.
Yes, it is mandatory. So very
Wonderful.
soon there's going to be a national council. Maybe it is already announced, the Allied Health Council, but till that time these state councils are working.
So once the national council comes out, so maybe the ones who are watching this interview, maybe watching it once it's done. So then there would be a website called Allied Health Council, and they can put the name of the therapist, and they'll get the list of members. Is that what you're saying?
Yes, so it is Allied Health Professionals Council, but something similar. It would be advertised, but it is Allied Health Professionals Council, and then they would get it. The nomenclature may be slightly different as far as the council is concerned.
I get that. So, but what I'm trying to ask you is, say if somebody watches this interview 4-5 years later, then this Rajasthan Council or the Delhi Council or the Maharashtra Council would still exist, or people would have to refer only to the main council.
They can refer to the main council. Simple.
Got that. And I think it also helps people to know, because sometimes, I can say that I'm an occupational therapist and I can start working, but a parent may not know whether I'm actually a therapist, right? So that's why it's very important too, na?
Yes, and I think
Because
it is the parents' right to ask the therapist, where are you from? Where have you done your graduation, post graduation from? So there's nothing wrong about it. It's the parents' right, and they should ask about these things.
Wonderful.